Diverticulosis merely describes the presence of diverticuli. A diverticulum is a pouch-like structure that can form through points of weakness in the muscular wall of the colon. Diverticulosis is often found during a test done for other reasons, such as a colonoscopy. Most people with diverticulosis have no symptoms and remain symptom-free for the rest of their lives. A person with diverticulosis may have diverticulitis or diverticular bleeding. Inflammation of the diverticulum is called diverticulitis, and this occurs when there is thinning and breakdown of the diverticular wall. This may be caused by increased pressure within the colon or by hardened particles of stool which can become lodged within the diverticulum. The symptoms of diverticulitis depend upon the degree of inflammation present. The most common symptoms is pain in the left lower abdomen. Other symptoms can include nausea, vomiting, constipation, diarrhea, urinary symptoms such as pain or burning with urinating or frequent need to urinate. Diverticulitis is divided into simple and complicated forms. Simple diverticulitis, which accounts for about 75% of cases, is not associated with complications and typically responds to medical treatment alone, without surgery. Complicated diverticulitis occurs in about 25% of cases and it usually requires surgery. Some of the complications are abscess, which is a localized collection of pus, a fistula, which is an abnormal connection between two areas, such as the bowel and the bladder, obstruction, which is a blockage of the colon, peritonitis, which is infection of the abdominal organs around them, sepsis, which is overwhelming body-wide infection that can lead to failure of multiple organs. How do you diagnose diverticular disease? Diverticulosis is often found during tests performed for other reasons. The two most common tests are colonoscopy and a CT scan. The CT scan is often used to diagnose diverticulitis and its complications. How do you treat diverticular disease? Diverticulosis. People with diverticulosis do not have symptoms, usually do not require treatment. Increasing fiber in the diet will help to bulk the stools and prevent the development of new diverticuli, diverticulitis, or diverticular bleeding. Increasing fiber is done by increasing the fruits and vegetables in your diet. However, obtaining enough fiber with diet alone is quite challenging. It is recommended to take a daily fiber supplement, such as Metamucil. Now, there's been debate about seeds and nuts. Patients with diverticular disease have historically been advised to avoid whole pieces of fiber, such as seeds, corn, and nuts, because of concern that these foods could cause an episode of diverticulitis. However, this belief is completely unproven. We do not suggest that patients with diverticulosis avoid seeds, corn, or nuts. Treatment of diverticulitis depends on how severe your symptoms are. If your disease is mild and you otherwise are healthy, you might be treated at home. This usually involves a liquid diet, pain-relieving medications, and sometimes antibiotics. However, if you develop one or more of the following signs or symptoms, you should seek immediate medical attention. These include a temperature greater than 38.5 degrees Celsius, worsening or severe abdominal pain, and inability to tolerate fluids. If you have severe disease, you are not in good health, or your symptoms do not get better in 2 to 3 days, you might need to be hospitalized for treatment. Initially in the hospital, you will not eat or drink anything. You will receive fluids and antibiotics, usually given through a vein by IV. If you develop an abscess of your colon, you may require drainage of the abscess. This is usually performed by placing a drainage tube across the abdominal wall under radiological guidance, or by surgically opening the affected area. If you develop a generalized infection in the abdomen, called peritonitis, an operation to remove the diseased portion of colon may be necessary. If you do not improve medical therapy, is another reason to perform this. A 2-part operation may be necessary in some cases. After an episode of uncomplicated diverticulitis, on the other hand, elective surgery is generally required, as the risk of another attack or requiring emergency surgery is quite low. However, patients with persistent symptoms caused by diverticulitis, a history of complicated diverticulitis, or a compromised immune system should be evaluated for possible surgery to prevent another attack. In such patients, another attack has been associated with a higher risk of complications or death. Of course, the decision will also depend in part upon your other medical conditions and ability to undergo surgery. After an episode of diverticulitis resolves, If you have not had a recent colonoscopy, the entire length of the colon should be evaluated to determine if the extent of disease and to rule out the presence of abnormal lesions such as polyps or cancer. Should I have surgery for my diverticular disease? Over time, diverticulosis may cause no problems, or it may cause episodes of bleeding and or diverticulitis. Approximately 20% of people with diverticulosis will develop diverticulitis, while 10% will develop diverticular bleeding. Approximately 85% of people with uncomplicated diverticulitis will respond to medical treatment, while approximately 15% of patients will need an operation. After successful treatment for a first attack of diverticulitis, about a third of patients will remain asymptomatic, a third will have episodic cramps without diverticulitis, a third will go on to have a second attack of diverticulitis, and only 10% of the people remain symptom-free after that second attack. Subsequent attacks tend to be similar severity, not increasing in severity as previously believed.